All right, ozone. So many people ask me what ozone is, and sometimes I feel like I don't have a really good answer. So I am going to do a video today on ozone. So ozone is O3, and this is always my opener, and I can lose people on this. Ozone is a toxin. Okay, so we've heard about the ozone layer out in the atmosphere. Ozone is actually as an inhalant. It will hurt and kill your respiratory lining. So it is not something to inhale. It is a toxin. So, but that being said, the way that we use it actually helps your body work better. Okay, so stay with me. I do ozone IVs. And so this is a pretty intense IV, just lots of steps, lots of things going on. So it's not just like a plug and play IV. What we do is I stick you and then I actually pull your blood out. And then I put that up into the IV bag. And what's really cool about the ozone IV is that you can actually see the color change. So when I pull your blood out, it's going to be dark. It's coming out of a vein. So that means that it had already delivered its oxygen to your body, and is heading back to the heart and lungs so that it can get more oxygen and then pumped out to your body. Okay, so it is supposed to be darker than the blood that's in your arteries. Okay, but if your blood comes out darker than other people's, what that means is that your body is using up the oxygen somewhere. So it can mean that you're not perfusing well at all. So that's a lung problem, but it can also mean that you're delivering more oxygen somewhere because it's either fighting an infection, there's inflammation there, there's recovery that's needing to happen. So if your blood is really dark, that means that maybe you need a little bit more oxygen going on, or maybe you need to perfuse certain places better with oxygen. Okay. So we take your blood out, we can see how dark it is, we put it up in the bag, and then what we do is I get the ozone and I put the ozone into the bag. Now, the second I put the ozone into the bag, ozone is no longer. It actually changes immediately to oxygen, which is O2, and hydrogen peroxide, okay? And oxygen is great. We need it for all of our cells, and we need it for repair, recovery. We need it to fight infections. We need it to have our immune system boosted. We need it to run a marathon. We need it to recover and regenerate. We need it to use our food as fuel. So oxygen is really, really important. And so we're already getting you, it's kind of like a form of blood doping, I guess I could say. So we're going to give you more oxygen. And then the hydrogen peroxide actually signals a full cascade of your immune system. So again, going back to people like with autoimmune diseases, okay, their immune system is upregulated in the wrong place. It is making antibodies to the wrong things, okay, different T receptors, different B cells. It's in the wrong place. It's not acting correctly. So what we're doing is that the ozone signals to the immune system to upregulate the right things to fight infections, but to downregulate the antibodies and the T cells that are going to the wrong things, that's such as yourself. So it's called an immune modulator. So it's not overstimulating anything and it's not understimulating anything. What it's doing is just modulating, getting everything to a good homeostasis. Okay. The other thing that it does is helps produce nitric oxide, which is a vasodilator. Okay, so this is really, really helpful for anybody who has damage to like the small capillaries. That can be diabetic retinopathy. It can be kidney damage, although anybody with like Raynaud's syndrome or like has issues perfusing their hands and feet, it vasodilates those vessels and allows for the blood to get there. And then we hyperoxygenated your blood, so you're getting extra oxygen to it. So that's really, really important for rest, recovery, regeneration, modulating the immune system. I'm trying to think of all the other things, awesome things that ozone does, but that's really the best part about it. Is it gives your body oxygen, helps dilate the vessels so that we can deliver that oxygen, and then it modulates that immune system. So that's the ozone IV. I also do ozone injections, which it totally creeped me out when I first did it. Um, Essentially, ozone is a gas. So it is what it sounds. You're injecting gas into an area. So totally creeped me out. I didn't even want to do the training when I first started doing it. But it is one of the coolest things. So we use a few different products that numb it and provide nutrients for regeneration and repair, and we can customize those based on your specific condition. So I do have a patient that has a bone spur, and we're using specific agents to help degrade the calcium deposits of the bone spur, and help with the regeneration and recovery of the muscles, tendons, ligaments in that shoulder. People with knee problems, we're doing pain, we're doing B6 for recovery. Anybody who has like nerve problems, we're using B12 for neurologic recovery. And then we use ozone, and it's the same thing. We're injecting that ozone, it changes immediately to two different things, and that sends this cascade of helping the body upregulate and tell it to produce the correct things to help repair and regenerate. So it's called like a therapeutic shock. Okay, this toxin goes into the blood or the joint or wherever it's at. So whether it's in the blood in the bag or into the joint or a muscle, and it essentially starts this cascade of immune events that help repair and regenerate that tissue, and it's phenomenal. I have seen some people go from not being able to lay on their shoulder at night to being able to sleep on their side. I've seen people, I did an acute patient the other day, just strained something. We did one ozone injection, and their pain was completely gone after the injection. They were a little bit sore the next day. We're back to their activities the next day. And so just there's so many applications for this. If you have questions on that, please send me your questions, ask me your questions, put them in the comments, whatever. But yeah, that's our ozone.